Okay. Hello, everyone. Thank you for joining us for this very important and much needed conversation on injustice and inaccessible health and feminine care for incarcerated women. I am Shaniqua Bonvillian, the Vice Chair of the Board of Directors of NewLife-Second Chance Outreach. And our mission is to end mass incarceration by equipping, empowering, and restoring socially, economically, and civically disadvantaged Georgians and impact and NRS. Excuse me, my vision is getting a little blurry today. Impacted by an arrest, conviction, or incarceration, focusing on 3 areas, which is reentry, education, and advocacy. In tonight's discussion, our guest experts will share their personal and professional expertise and experiences as formerly incarcerated women who were personally affected by the injustices and inadequate health and feminine care while incarcerated and how their experience inside have contributed to their advocacy today. Excuse me. Their contact information, HOAPE's one-pager and cited sources will be dropped in the chat, but don't worry about writing anything down, as everything dropped in the chat will be emailed by Friday. If we have time for a Q&A, it will take place at the end of the discussion. So if you have questions, feel free to drop them in the chat, and any of the panelists, myself or the moderator, can respond to them in the chat or out loud if we have time for Q&A. Also, should you come on the camera to ask questions or drop a question in the chat, please refrain from using terms such as prisoner, felon, convict, inmate, criminal, etc., as these terms are not appropriate and are disrespectful. It would also not only but strip people of their humanity and often used to justify the cruel and unjust mistreatment of people impacted by the criminal legal system. Lastly, if you are not speaking, please remain muted. And if you are on camera, please be mindful of what is happening in your background, as the discussion is being recorded and will be shared on the internet. So everybody that may need to use the bathroom, please just mute and also cut your camera off. All right. So with that being said, now before me, we meet our panelists. I'd like to introduce tonight's discussion moderator, my fellow New Life Board Director, Dina Dickerson. Hi, Dina.
Hey, Shaniqua, how are you? Hello, everybody. Welcome. I'm so excited. I'm here in Alabama. Just real grateful today, if you cannot tell. So, Shaniqua, that was a wonderful introduction to this program. And I will, at this moment, if it's okay, introduce our Women of the Hour. And I am on this laptop, and I mean, it is giving me one fit. It's giving me a fit. Can everyone hear me? Okay, so now let me introduce the Women of the Hour. We have the ladies of the HOAPE Coalition, and HOAPE stands for Helping Others Achieve Power and Equity, and was started by the ladies in 2023 as a call to action in response to empower Georgians to build sustainable knowledge, power, and prosperity through voting, but has since gone beyond voter engagement to include policy, community outreach, job readiness, and employer education, advocacy, and direct service. HOPE is dedicated to creating a more equitable, just, and inclusive Georgia where every individual's rights are protected, including justice-involved citizens. HOPE is composed of 4 Georgia formerly incarcerated Black women-led nonprofits, which is Women on the Rise, ReNforce, Women with a Plan, and of course, us here at NewLife-Second Chance. So first, let me introduce you to Mrs. Robin Hasan-Simpson, which is the Executive Director of Women on the Rise, Georgia. which is a grassroots membership-based organization led by Black formerly incarcerated women and other impacted by the criminal justice legal system in Atlanta. She served 10 years inside of Georgia prison system, and while there, created a newsletter to help uplift and organize women inside. She's been featured in local and national news speaking about mass incarceration and voter disenfranchisement, including Time Magazine. Robin has completed fellowships with Just Leadership USA, Women Transcending Collective Leadership, and Women Organizing for Justice Opportunities. She currently serves on the board of Illinois Alliance for Reentry and Justice, the Client Council Board for National Legal Aid and Defense Association, and the chair for the Vision Committee for Fulton County Diversion Center Justice Policy Board. She resides in Atlanta, Georgia with her husband, Ronald, and four-legged friend, Nova. Welcome and welcome and welcome, Robin. Robin? That's awesome. That is so good. Now let me introduce Charlotte Garn. She is the founder of ReNforce, an Augusta nonprofit that provides training and coaching to businesses looking to hire justice-impacted people to meet their workforce needs, while also providing training and professional development to career seekers. Last year, she opened Redemption House, a transitional housing program for formerly incarcerated women. As an advocate, mentor, and social change agent and educator, her desire is to assist formerly incarcerated females returning home with more professional and wholesome opportunities to obtain employment and housing and to meet their goals for self-sufficiency. Through her advocacy, Charlotte uses her personal and professional expertise to shift the local community's perception of mass incarceration, especially affecting the women, especially affecting the female population, and works to reduce the stigma and prejudices surrounding formerly incarcerated and or convicted individuals. Charlotte has a bachelor's degree in criminal justice and a master's of art in counseling. She volunteers with an array of organizations from the United Way of Prison to PhD. She serves as a mentor to young women across the globe who advocate for criminal justice, social, and healthcare change. She currently sits on the board of Liberty County Reentry Coalition and the Carnegie Writers. Hey, Charlotte. Now let's introduce Ms. Tabitha Trammell, who is the founder of Women with a Plan, a Georgia nonprofit that empowers recently released and formerly incarcerated women with achieving safe, healthy, and fulfilling lives within the community by providing basic needs for them and their children. She provides mentorship, personal development, educational courses, business support, and supportive services that inspire them to become more economically active and personally fulfilled. As a certified birth and postpartum doula with Women with a Plan, Tabitha Trammell provides personalized care, education, and emotional support to incarcerated and formerly incarcerated mothers and family members preparing for childbirth. As a woman who is living a life of long-term recovery, Tabitha advocates for the centering of substance use disorder and mental health treatment when also talking about the key contributions to a successful reentry. Tabitha advocates for the centering of, through her personal experiences with addiction and recovery, Tabitha uses her expertise to support others in living in recovery through her previous roles as a substance abuse counselor, a Narcotic Anonymous and Alcohol Anonymous meeting facilitator, and as a public speaker, sharing her own journey of overcoming obstacles to regain custody of her children after incarceration. Tabitha is a board member of this great organization, which is NewLife-Second Chance Outreach, Inc., Across the Bridge and the Greater Gwinnett Reentry Alliance, and is a graduate of the Women Organizing for Justice and Opportunity Leadership Lab. And as an alumni of Represent Justice, where she produced a short documentary called Mama, I'm Different, in which she candidly addressed her own mental illness and past substance use, how both contributed heavily to mass incarceration and how communities can support those living with mental illness. Now, Tab, that was awesome. Now, last but certainly not least, the founder, my good friend, the innovator, of course she is, the one that's always up in the middle of the night doing the next thing that cannot wait till the next day, of this great organization, Walisha Wilson Menifee. Walisha is a sought-after speaker, workshop facilitator, dedicated criminal justice reform activist, organizer, nonprofit founder, and a multi-preneur. In response to addressing the lack of services for individuals with criminal records in her hometown of Columbus, Georgia, she started this organization after her release from prison in 2011. Through her extensive personal and professional networks and her skilled resourcefulness in finding background-friendly resources, Walisha has assisted thousands of individuals in Georgia and Alabama with connecting with community resources, self-advocacy, tools, and leadership training, and opportunities that have helped them survive, thrive, and become successful, to include employment, housing, going back to school, and starting their own businesses. In addition to leading this organization, she leads the Georgia chapter of All of Us or None and sits on the board of directors of Restore Georgia, a Georgia nonprofit that serves as a collective voice for those impacted by sexual offense laws in the state of Georgia, and runs 3 businesses. She is an alumni of Just Leadership USA, of Soros, the Soros Justice Fellowship, Women Transcending Collective Leadership Institute at the Center for Justice in Columbia at Columbia University, and Represent Justice, where she created and produced her own short film, Working in Captivity, A Woman's Quest to End Slavery in Georgia, a documentary to educate and expose the current legalization and use of slavery in the state of Georgia via mass incarceration. Her activism and strong voice has led to many awards, including being a 2017 recipient of a Georgia Senate resolution, Senator Edward Harbison, SR 121. Writing a 2019 opt-in with actress Alyssa Milano and being contracted by the SBA in 2023 to be a part of a solution to helping business owners who were previously convicted of crime get equal access to small business funding, such as the PPP loan, which resulted in the SBA changing their rule to not exclude justice impacted business owners from loans and based solely on a felony conviction. However, the award she is most proud of that her advocacy led to was being contacted by the women who prosecuted that apologized to her and had her exonerated, putting all end to her having to serve 25 years on probation and completely clearing her record. Walisha is currently working on launching her 4th business, resides in Atlanta, where she works at Southern Center for Human Rights and is a member of America's Free Church, the historic Ebenezer Baptist Church, where the Reverend Dr. Senator Raphael Warnock presides. Whew. Boy, now those bios were impressive, very much so. Thank you so much for your advocacy and for lending your voices and experiences and expertise as panelists for tonight's discussion. The ladies of hope, everybody, or shall I say, the core 4, welcome. Now let's get into the discussion. I will ask all of you or some of you the questions and ask that you limit your response to 2 minutes or less. The first question are for all of you. We will start with Robin, then Charlotte, Tabitha, then Walisha. Is that okay?
That's fine.
Okay. So I know I had a mouthful to say, so now I can shut up so the real experts can speak. It's okay. All right. So it is common sense that women have different health and hygiene needs than men, but yet when women are incarcerated, we are denied the very thing that we require of as women, such as pads and tampons, pain medication for cramping, pap smears and breast exams, prenatal care, and even the dignity while giving birth. Uterine fibroids are a significant reproductive health concern for women, and their prevalence can be made worse by incarceration due to the limited access to health care, delayed diagnosis, and sporadic treatment. Ladies, can you tell us about your personal experiences with accessing equitable health care during your incarceration, or that you observed other women experiencing and how it impacted you while you were there? Again, we will start with Robin, then Miss Charlotte, Tabitha, and Walisha.
Okay, thank you, Dina. Well, for me, while I was incarcerated, I was dealing with endometriosis. And during that time, I did not, of course, have the adequate access to pads. Because of my endometriosis, I didn't utilize tampons. And so I never was able to get what I needed. Thankfully, I was able to go to the store to be able to buy what I needed. But even though I didn't think that was right, because they consider me property of the state, so you should provide me with what I need. But during that time when my endometriosis was getting worse, they offered me many times to get a hysterectomy, which I refused because one, I didn't want to have the state. I felt like they was taking enough from me. I didn't want them to take, my uterus as well. So that's why I was like always declining it. But they never could give me anything that was adequate for my pain that I was enduring. So they always tried to give me Tylenol or
Ibuprofen.
those are the two things that they always try to, to mask the pain that I was experiencing. And I have bled so much that I actually had to get a blood transfusion, which again, I tried to decline it because I'm under the notion that I'm incarcerated and I don't know you're going to take me to a hospital to get blood. I just don't feel like y'all were going through the same procedures to someone who was free. So it took a lot for them to convince me that I needed to get a blood transfusion. But after that, it was like they're still not treating my symptoms of what I was having with my endometriosis. So it pretty much led to when I was released, me actually having to get a hysterectomy because I had developed fibroids and cysts that went so many years untreated. So in the end, I ended up still having to get a hysterectomy at the age of 48.
And for me, I served 46 months and I was in the federal prison. Prior to incarceration, I had fibroids, but in 2006, I had a UAE where that's the procedure that they go into your growing area and clip the blood flow to it. And during that time, it worked for a couple of months and then it intensified. And then in 2000 and I think it was like 8 or 9, I had a myomectomy and I paid for that out of pocket. And the myomectomy was where they cut the fibroids off of my uterus. And so from there, I thought, like everything is good, even though the doctor told me like they could grow back. If you're pretty much taking care of yourself, if you're eating, if you're doing what you need to be doing, you should be okay. And so one of his treatment methods for that was birth control. I wasn't one to like anticipate or like, oh, I want to be a mom by a certain time. I honestly didn't care about a biological clock. So for me, the birth control was fine. When I became incarcerated, the challenge was coming through A&E, they ask you about your medications and things like that. I was getting this shot at the time. I was told that once I got incarcerated, that I wouldn't be able to continue the shot as it is a birth control method. And being that the prison system itself considered it a birth control method, that they would not like pay for it. And I offered to pay for it, but they said no, they don't even want that on the compound. So needless to say, I didn't get that for the 46 months that I was incarcerated. And during that time, on top of compounded with the food that they give you and the juices and the things that are not the best and the healthiest choices, needless to say, my fibroids grew back. Fast forwarding, exiting prison in 2017, I had a severe issues with fibroids, to the point of I too, like Robin, in 2017 I found out not only did I have the fibroids, but I had the endometriosis and things like that, and I stayed on medications for quite some time to be able to deal with it, because it was a constant pain. One of the things that, you know, you have to sign up to go to the doctor. You just can't show up. They had sick call, you know, every day, and you had a line, and it was just not just my health issue that was a challenge, but other women's health issue that was a challenge. So during that time, while being on the shot, I didn't have a period before, but as I stayed incarcerated, I had a period. And one of their things, we talk about inadequate healthcare needs, they would ration out 2 pads for women and 2 rolls of toilet paper for women. And it's like, when you're thinking about your hygiene needs and things of that nature, and you're not given those things during your prison time, it makes your time so much more difficult. But fast forwarding out, right now, I still suffer with fibroids. I haven't had a hysterectomy, but I did have conversations about a hysterectomy. But compounded with the fibroids and everything, now I'm in the state of perimenopausal very quickly, and having to deal with that. So for me, although I have not yet to have a hysterectomy, I'm still suffering with fibroids that have grown back during the 46 months while I was incarcerated, and now am bearing and carrying that in my body and bearing the burdens or the hardships around those fibroids medically, that I have to address from day to day.
Good evening,
Thank you.
everybody. Oh, I'm sorry.
No, go ahead, Tam. Thank you.
Hey, I want to talk a little bit about the healthcare and the personal experiences that I received before I went to prison, when I was going back and forth to jail due to my petty drug sales and my addiction. I was in and out of the county jail and the city jail. I had just had a baby, and I was really, really bleeding real bad. They wouldn't provide me but with 2 pads. I had an older lady in the cell with me that had to cut up towels and stuff. And then when I ring the bell, they got angry and they would retaliate and put everybody on lockdown because I stayed on the bell, you know, asking for extra products. So by them penalizing everybody, that made everybody mad with me. And not only knowing that I was bleeding like that, I was going through postpartum and I didn't know none of this. So the services was very poor. And that was fast forward. And that was my child now is 40 years old. And I got clients now, fast forward, they're going through the same thing. So we know that the system is really failing us. It has not changed. And I look at that and go and try to service my clients on the services I wasn't afforded when I was in there, far as the extra pads and the just trying to refer them to mental health, far as the postpartum aspect. Walisha?
And I think for me, like Tab, unfortunately, when I went in, I was 650 pounds. and was preparing to have my very first weight loss surgery, but I had a hole in my spine. So I had a lot going on when I went in. And in the instance of when I'm always doing stuff or when I complain to go to the doctor, it was you need to lose weight. So, I mean, I could have a cold, you need to lose weight. You know, if I'm complaining about serious pain, I think I tended to over medicate myself because I did at that time still do live with depression. I was taking pain medicine that you use for depression that normally puts you to sleep to help curb my pain. But unfortunately, like me, with the fact that I would, like when I say most folks have a cycle that's 3 to 5 to 7 days, my periods were 3 months long. So I would go 3 and 4 months bleeding very heavily and could easily go through an entire pack of pads in one day. But when I went in there, they gave me 2 or 3 pads in one day. And I used to could have to wear tampons, go through maybe 12 to 15 tampons and 12 to 15 pads in the same day, and you're giving me 2 pads. So I had to ask them, do y'all not know women don't have periods? You know, I'm sure your mama do and your daughters do. So I don't understand why you think because I'm locked up that all of a sudden I'm supposed to stop bleeding. So those were the problems that I was having. And I was actually locked up with a woman who was having serious cramps, and they wouldn't even give her anything but Tylenol. And I think that was just awful. So those are kind of like my experiences. And then to myself, I got locked up, pretty much put in solitary confinement because I was disabled, and they just basically got tired of me. And so I had no choice and then in solitary confinement, you can't take a shower every day. We were able to take a shower every 3 or 4 days or maybe once a week. And that's not good when you're bleeding like that. And so I would end up ripping up my stuff, maybe using my pillowcases and sheets, but then I would get in trouble for that. So yeah, and I think part of the problem is that it's just men, but what really surprised me was the fact that it's women. It was the women COs that were not lacking any type of empathy. And so that was the problem. So I think then it was like, why do we have, prisons for women separate from men if y'all are going to not treat us as if we're women? So those were my experiences.
Thank you, ladies. I know that, jumping into it is heavy, right? There's no way around it. So I just want to say thank you guys for being willing to just open up and share vulnerably so and real and raw. As formerly incarcerated women who have dedicated their time as social justice advocates and activists since your release, how have you used your personal experiences with this issue to bring awareness or to advocate for women who you all have left behind? And all of y'all can answer that, and we'll start with Ms. Robin.
Well, I mean, what we do is when we talk to the women inside, we always just, seeing what needs are not being met. Like they already will contact us and let us know, like, hey, we're not getting soap or we're not getting tissue. Or we even have connected with one organization that actually did a policy around getting pads and tampons to women when they needed it, not just the 5 or 10 that they give you each month. And found out that, they're not following that policy. It's supposed to be SOP and they're not following it, which we're not surprised because we lived it. Like we knew that they weren't following it. So what we do now is just try to make sure that when women are in need, we reach out to let people know this is what's needed, especially at ACDC when we have things, something as simple as there's no water, there's nothing, that things that's going on within ACDC. We have to reach out to people to make sure that the needs are being met for women that are incarcerated.
Ms. Charlotte, and all of you guys are going to answer that. Do I need to?
Thank you for that. So pretty much the same, because we have a women's home. One of the things that we pride ourselves on is being, as Robin said, being an advocate for the women. Of course, we know things are kited back in, or there's conversation about who's doing the work and who's supporting the people on the outside. That information gets in. So we've started getting a lot of mail from women letting us know, hey, this is what's going on. And we're providing that support and the advocacy for that. And also too, when we're in spaces that we're talking to business owners or other allies, and they ask us how can they support us, we let them know, like when it comes to specifically women, the challenges and such that we encounter while we're incarcerated. And those challenges are not just only medical. You heard Walisha talk about like having the mental health component. And I think that's a part of the healthcare system for those who are justice impacted that are constantly forgotten about. The traumas and such that we experience having a period, not having resources, not having the things that we need on the inside, we bring those things outside. And another thing that we pride ourselves on is when we get women in the home, that is one of the very first questions that we get. Well, how many pads, how many tampons can I get? Like, we don't ration that out. That's totally up to you. This is your space, this is your home, and make it as such, because we don't want to have an environment of confinement. We don't want to have an environment of prison. That they've carried on the inside and bringing it on the out. So specifically, supporting the women by being the advocates, by being the allies that they have, and sharing those experiences and getting the resources that's needed to support them while they're incarcerated. So when they make that exit outside and they're able to reintegrate, that their reintegration is successful and they're supported.
And I think with me and my advocacy, most of my advocacy does right now since I've been released has been focused on job readiness and connecting folks to resources. But it's only been recently where when we deal with people personally, where we're getting a lot of phone calls or letters from folks inside of prison. And a lot of them have been women. And I think one of the biggest problem that's not necessarily triggers me anymore, but really upsets me because a lot of them they're telling me I know something's wrong and I'm not. And I used to have this same issue. For one, I think a lot of the issues come with as Black women having white doctors. And I think that's just historically where they feel like Black folks have a greater amount of pain tolerance. And I think prior to me going in, it was, oh, you're just fat. Oh, you're just this, you're just that. I mean, literally, if I thought I had cancer, it's because I'm fat. You don't have cancer, just lose weight. Losing weight is not, of course, when you already have weight on you, weight gives you more estrogen, so it's going to make you bleed more. But I did not know. All I knew, I was cramping, I was having pain, and I was told it's because I was too big. But the whole time, probably before I went in, I actually had fibroids. And they may have been one or two small, but by the time I got out, it was worse. And then I myself had to have a hysterectomy just last year, and I had 4 of them the size of a grapefruit. So this is going over a period of me getting in prison, not having anything, or maybe having something small that could have been resolved. But like Robin said, even if they did offer to do it, I probably wouldn't have wanted to do that because y'all don't even, give people clean water. So I definitely don't want, I just didn't want to deal with that. So right now, in what we're hoping to try to really do now with some of the issues is me personally, putting money on folks' books so that they can have it specifically so they can have what they need. But like Robin said, you shouldn't have to pay for that. If you know that you're getting somebody in prison that has diabetes, it is your responsibility to give them insulin. If you know that you're having women in prison who are in need of some things, what we desire as a woman, that should be given to us free. And me, myself, I also was on a birth control when I went in. And I had to be on that, not because I was trying to avoid having children, but that was to regulate my cycle. And they refused and took me off of it. And once then, it was all bets all over. I'm finna bleed 3 months straight. And they don't really care anything about it. You still have to go out and you get that one uniform. So if I messed it up, that's how I was walking around. So it was just awful. And so most of the time I use my advocacy now really to just piss people off, hold people accountable, and call a spade a spade. And that tends to upset a lot of people. But I don't think it's because people don't know it. I think people just don't want to hear it, or they think that they're doing us a favor by giving us 2 pads a day, you know, or things like that. So, but yeah, I think that's how I've been using my advocacy, and I use my voice as my advocacy. I didn't know if Tab was on or not.
I'm here. Me, with my past experience, what I've been telling my ladies in Gwinnett County, how I advocate to them, I use my past experience, how I used to be real hostile with the guards and stuff. Because I was frustrated. I was bleeding all down my leg, and they made me go to the child hall like that. You know, just anything to humiliate me because I was retaliating. So what I did, what an older lady told me, and now she said, you know what? Sometimes you can't fight fire with fire. And I've been teaching my ladies how to do thinking for a change. What you do is make them feel they're right. Even you can't retaliate until you get what you need. It's all about getting your needs met. And I tell them that. And what we've been doing up here in Gwinnett County, we partnering with helping mamas. And I've talked to the counselors on a nice level. So I said, hey, we got extra period products. Not saying that nobody complained that they didn't have any, because that's really what it is. I said, hey, we want to donate because you guys are doing such a good job. And we want to help you out with this right here. So that's how we doing it on the reversal tip, to make them feel that they are important, because they got a superiority complex. And me being mad or calling up there, disturbing the people up there right now, it make my clients suffer. So I had to learn that, because sometimes I get out my normal self and I say things that I regret later, that I got plenty of pads, and I got to think about Sharon or whoever in Gwinnett County that really need them. So that's what we've been doing, that type of approach. And for right now, it's working. But you know how that go. It changes by time. Thank you.
Thank you. Great job, ladies, on your advocacy. This question is going to be for Ms. Robin and Walisha. According to the National Library of Medicine, evidence shows that more than 80% of African American women and approximately 70% of white women will have uterine fibroids by the age of 50. Research also shows that because Black girls start their cycles earlier than white girls, that we have fibroid diagnosis. We have fibroid diagnosed at an early age and are most likely to be symptomatic and likely to have different responses to medical treatment than white women. That the size and growth rates of fibroids are greater in African American women, and that we are hospitalized and getting myomectomies and hysterectomies at a higher rate than other racial groups. So based on the statistics that states that this disproportionate rates that Black women get fibroids in a non-medical capacity, of course, just in your personal opinion, what do you think contributes to a huge disparity in the fibroids in Black women versus in other races?
Well, two things. I think one is our diet. Our eating habits are different. So that does contribute. But I think the main contribution is the fact that we don't get the same care of people that are not of color. Um, it's like doctors don't listen to our needs. They don't think about when we say we're in pain. It's like we have to prove we're in pain. Like, for instance, when I had my hysterectomy, I kept, the very next day, I had my hysterectomy on the Thursday. That Friday, I'm experiencing hotness and heat, and I'm thinking it's something going on because of my cycle, because of the cycle, because of the surgery. Come to find out, I went straight into menopause. And I didn't understand. I kept telling the doctor something's not right. And I was having them like every three times every like an hour. I'm having a hot flash, and it was like outrageous. And I'm like, okay, I can't do this. Like, there's something, like, attitude was changing, my body was changing, and he did not give me the adequate information that I needed to have. And of course, I'm talking to other women that have experienced it. I talked to a lot of older women, and like, what did you go through? Then I realized everybody's experience is different. So I couldn't really get the information there that I needed. So I just finally broke down and found me a black doctor, black woman doctor, and I like, look, we gotta do something. I can't keep doing this, having a fan in every room of the house, and at night I'm sweating, I'm waking up and shower at night and shower in the morning. It was just too much, and I'm like, I know women are not living like this. It's something got to be done, and so when I finally went to this black woman OBGYN, and she explained to me like, yeah, this is what your body's going through, this is why you're feeling what you're feeling, and here are your options. It's a totally different world, you know. And all she did was subscribe me this patch. This patch has been my lifesaver, and I tell everybody that's going through this the patch. And it's just like, why? And I even asked her, why couldn't this doctor tell me, this male doctor, male white doctor, and she's saying a lot of times that they just think it's just normal and that what you're supposed to go through, but there are things that can actually help you. So I think that's a major problem, is that we're not listened to. Like they look at us like, oh, you're supposed to endure it. For one, because they look at black women, we're supposed to be strong, you know, and so they're okay, they can endure it. And yes, we are strong, but why endure something we got to? So that's to me the reason, is just like they don't listen to us. They just disregard how we're feeling.
And I think in addition to what Robin was saying, not just our diet and not being listened to, but I think a lot of it also is socioeconomic. I think, a lot of us are probably brought up in poor families. It's not something that routinely, I know my mom, who was on an active addiction for 30 years, and a lot of us aren't going to the doctors regularly. Same thing with going to the psychiatrist. I mean, as a child, I grew up in foster care, but I would see white kids going to the therapist. So that's just, to me, different. And with black folks, we're not going to the therapist regularly. We're not going to doctors regularly. Sometimes we're not going to the dentist as children. We're not. And a lot of time it is based on poverty, but even when you have Medicaid, just the culture, I guess, and it's something I definitely wouldn't say on all culture, because there are plenty of black folks who go through their life with having it. But I think the majority of us is just socioeconomic. That's not some of the things that poor people prioritize with going to do and see what needs to be handled. But I definitely think a lot of it is my mom, she used to have the same issues. And because she was on drugs, they didn't want to give her nothing because they thought she was coming in there to try to get pain medicine to get high. When in fact, she was in pain. And it was just sort of the same thing with me. I've never been on drugs, but it's like, well, why don't you do this? Why don't you just lose weight? Why don't you try to eat a little healthier? Man, I'm hurting right now. So eating a leafy salad is not helping my pain right now. And so I think it has a lot of combination of it, but a lot of it is just not understanding the cultures that you are working with and knowing that pain is pain. And it used to really kind of piss me off when I would see white girls with the same issues in jail. They would give them stuff, even though they would give me ibuprofen and Tylenol, they would give them 3 or 4 of them. Because it's something about you not wanting to see a white woman in pain, but you didn't have a problem with me being in pain. So it's that kind of stuff. And I think a lot of it is just based on ignorance. And I think a lot of it is biasness. But I just think a lot of folks who are in the medical field aren't really, they themselves are not really, they probably have the medical knowledge, but just the bias, they need to learn how to get rid of that bias. But I think a lot of different factors contributed between the diet, the way we're brought up, and the money and stuff, and making sure we get that done. So yeah.
Thank you, ladies. I agree. The next question is going to be for Charlotte and Tabitha. With the statistics being the way that they are, especially when it comes down to how Black women are disproportionately impacted by inaccessible health care and the higher rates of fibroids, what do you think, as a Black woman, that the issue of fibroids and lack of adequate health care overall isn't a public health issue, particularly for those women that are currently incarcerated?
I think it's lack of education, and it's 2 A words: available and accessibility. It can be available, but if it's not accessible, like certain insurance plans, they say everybody got marketplace insurance. Okay, cool. But if the doctor is 2 hours away who accepts it, it's not accessible. Okay. Now, and educational wise and support, like this group of women here. I've been suffering from fibroids all my life. Now I have a hysterectomy on May 24th because of the education Robin and Walisha have told me. Because fear lives within us. And if you don't know no better, the doctor don't offer you, this is what you need. And in Black communities, they'll just treat the symptoms right there. And they don't even tell you how to alleviate the problem. They're band-aided sometimes. You know what I'm saying? Instead of giving you whole information where you can go on and treat this thing. So me talking to them, I've been, it's sad. I've been bleeding all that time, 2 fibroids the size of grapefruits in me. But the support of them have made me go on. I've got my schedule to do my surgery. And now I have a Black doctor that's most sensitive to my needs and stuff. See, we got to get people, and it's bad to say it, that's sensitive culturally and morally, because a lot of people don't care about us. And we want to think that the whole world is thinking on an equal basis, but it's really not. And being a Black woman, number one, you overweight. The first thing they're going to say, when I had my other doctor, you overweight, you cramp a lot because you overweight. That ain't got nothing to do with it, and they think we just like research animals. They just tell you anything and want you to suffer. When my doctor told me, he gave me a whole plan. This is what you're gonna be. You're gonna be in surgery this long. This is this. This is that. Make me feel empowered to being able to make this decision, so I'm not scared anymore. So we're really looking at education, empowerment, and different support that we can offer these clients incarcerated and the women that's out too.
And I also think, in addition to what Tab is saying, because I think the accessibility is definitely key, and something that Walisha said, it is very valid. We have to look at things from a cultural standpoint, because sometimes for our Black moms and dads, those things weren't talked about. Like, you know what I mean? Growing up, we didn't have, or I don't recall having that conversation with my mom. But what I do recall now that I'm older is hearing that my sister had problems with her periods and her cycles. My other sister did as well. So sometimes I think just being open enough to culturally having these conversations to say, hey, these things may come up, because what it leaves us, especially as Black women who are just as impacted, we suffer in silence. Because, as Robin said, I think I'm the only one, but you're not the only one. As we began to get more comfortable with talking about this doesn't feel right. I cramp when I do this, or it hurts when I have sex, or this is going on, or whatever, to be able to just have these open and honest conversations, not only with your girlfriends, but with your spouses and with your mates as well. So I think just normalizing conversations and not being so easily to dismiss us. One of the things that I'm definitely a proponent of is advocating for my health care, and not just for me, but for my mom, for my siblings, for my nieces, and for my nephews. You need to open up your mouth and talk. You need to let people know what's going on. And what that looks to me is identifying a treatment team, a medical treatment team that looks like me. I've started going to a chiropractor. She's Black. OBGYN, she's Black. Another, just my family doctor, she's Black, because I am starting to surround myself with a treatment team who looks like me. So when I go in and I say, this is what's going on, I'm not getting, what's on a scale of 1 to 10, what's your pain level? What difference does it make? I'm telling you I'm in pain. So what can we do about it? So I think just the ability for us to know we don't have to suffer in silence. And I think part of that too, specifically when it comes to us as being just as impacted as Black women, I think one of the bigger scopes is we've never been seen as an investment. Black women, we've never been seen as the backbone of this nation, of this world, of mankind. We've just been, and when we think about it from a slave focused standpoint, we've never been uplifted. We've never been embraced. We've never been considered to be soft. We've always had to be independent. We've always had to be boisterous. We always had to be loud. And in sometimes the non-Black people, well, not sometimes, all the time, non-Black people they don't embrace that side of us. So for us, I think we've never really been seen as an investment. So when we say these things are going on specifically to Black women, it's like, okay, so what's new? You know what I mean? So, okay, y'all can get over it. Y'all can deal with it. But no, I think we need to be, as Tab said, educated and have that accessibility to say, no, this is not okay. And I don't want to go through life feeling this way. And also too, specifically for the incarcerated women, and I can speak from this for myself, that the reproductive justice is not considered, it's considered optional, not a necessity, because I felt like if I could have continuously got the depot shot, I would not have fibroids. So, but they consider that, oh, that's not a necessity. That's, you don't need that. But in actuality, I did need that. So I would say those would be some of the things that definitely when it comes to Black women and Black incarcerated women, that's standing out for me.
And then before you go on, I just want to chime in that it should be a public health crisis because of the present, just the numbers alone, the fact that over 80% of Black women are getting fibroids, and particularly a large number of these folks who are incarcerated, it definitely should be a public health crisis. And it really lends me. And when I remember telling my grandmama about it, and I told her, I said, I never wanted to have children, but if I wanted to have children, prison took that from me because they did not properly diagnose me and they did not handle what I need to do. So yeah, of course I didn't want to have no children at 47, 48, but give me that option. And I didn't have that option. And she said, well, baby, that's a public health issue. Back in the day, they used to, I guess what you call it, make Black women have hysterectomies anyway. And she said, that's just a way to contribute from depopulating us. And the way I thought about it, she said, so that's a public health crisis anyway. So that's kind of way y'all should be taking it, So I just want to put that in there because as you mentioned about it, you asked the question about it being a public health crisis. It really should be to me. And for that reason, because it lessens the population. And I think a lot of times it's done intentionally.
This is definitely awesome, very informative, very empowering. I'm having all kind of thoughts as you ladies are sharing so candidly and open. And my thoughts were along the lines because I invited a couple of my friends that's over at the University of Alabama at Birmingham. I was saying, hey, we're on here. It's a great conversation. And my thoughts now have wandered to who else should have been on this panel? You see what I'm saying? Who that's in spaces that this discussion need to be widespread because we on this line, we are always standing on the front line and up for those individuals that have our experience, some of the harshness and the psychological effects of long-term incarceration and all of the things. And then especially for those that we know that we left behind. So I think going forward, we really need to see if we can do this again and invite some of those persons in so many different spaces to this call.
I think Tab had a hand up.
Yeah, I'm just that, I can't help it. Robin and Charlotte, we know that this question is going to be for you. We know that there's so many symptoms when it comes down to fibroids, and some of those symptoms include the heavy bleeding, severe pelvic pain, and though there are several treatments for it, a hysterectomy still remains one of the common interventions as fibroids are the leading reason for hysterectomies. As stated before, African American women are 2 to 3 times more likely to undergo hysterectomies for fibroid tumors than other racial groups. What impact this have on women, particularly Black women, and our communities as a whole? What impact does it have?
Go ahead. You want to go, Robin? No, go ahead.
Alicia said something earlier. Go ahead.
I was was gonna say, one of the bigger things, like Walisha said, it breaks the family systems before they even start. Because when you think of the first line of, hey, you need a hysterectomy, the Black woman's ability to reproduce is instantly gone. And so from there, you're not able to reproduce another Black voice, another Black advocate, another Black doctor, another Black president. You're not able to reproduce that. So I think that's definitely it. And also too, it continues like the generational trauma and generational trauma around body autonomy and the reproductive system. Like having specifically a white male tell you or tell us that we need to have a hysterectomy without that's your first line of healing from a fibroid, or healing from fibroids is a hysterectomy. It's giving someone total control over my body. And I remember the first time that when I started going like, hey, I think I need to have surgery from the fibroids or whatever, I went to a doctor, and he was a white guy from New Orleans, but he was living in Charlotte at the time. And he had my record. He did not open my record. He did not open my chart. He just had it in his hand. And he came in the room and he was asking me questions about how long I had been suffering from fibroids, how was my bleeding, how was my sexual intercourse and all of that stuff, and was it painful in this? And I was giving him responses, and his response to me without opening up my chart, without anything, was, you need to have a hysterectomy. And for that to be his first thought, I immediately was like, wait a minute, you didn't open my chart. You didn't ask me anything else outside of, do I have children or anything? It was more so, this is what we do. I immediately left, and I wound up calling the board and filing a complaint, because that should not have been the case. So I think it brings up triggers and traumas when I do go have white male doctors, because that's the conversation. So when you ask that question, Dina, is definitely the inability to reproduce another Black voice or another Black child into this world. And then two, is continuing the generational trauma that we experience of having a say-so over our body, yet again, having some white male enslaved master tell us, this is what you need to do with your body. And so that's a huge impact.
Thank you. Robin?
Charlotte just said it all. She
Sometimes
summed it up, because I think it's not even like the call out tab, but it's really like, listen to what she said earlier when we were all on our group chat, and she's telling us the pain she goes through. Like, she's been telling us this for the last, 2 years, Tab, the pain you going through. And of course, I got my hysterectomy last year. And of course, I'm telling them, like, y'all, these hot flashes killing me, these mood swings, poor Ronald. And so when I finally found something, I'm like, oh my God, okay, I'm so much better. So really, it's like the fear of going and having a hysterectomy, because one, as women, think about it, you're taking something from us that we feel, even though it isn't, but we feel make us women. So you are taking away something natural of our ability to give birth. So you taking that away, and then taking that away, and then you're having all these other things happen to you. Some women, thank God I didn't go through this, but have hair growing and all. So it's like, you feel like, are you taking away my womanhood? So when you look at it that way, a lot of women like, I don't want to go through that. I don't want to do that. But I told Tab, it was the best decision I ever made, even with the side effects I had from it, because the pain was so great. And even though I got the fibroids cut out, since coming home from prison, they grew back. I've had cysts since I was 15 years old, get them cut out, they grow back. And it was just something that just, I know I was going to deal with. So I'm at the age like, look, I'm not having no more children. I know I'm good. Why am I going through this pain? Why am I enduring all of this? So I just had to get out of my head that this is what makes me a woman, and realize there's much more to your body than just your reproductive organs.
And I want to just chime in before Tab chimes in too. That is one of the things that we hear, and we need to get out of that. Whether it's domestic violence, these roles that we're supposed to be in. You're not a woman if you don't have children. Let me tell you something. I won't have them. Yes, I wanted to have another little Walisha around here, but I probably wouldn't be able to deal with her mouth either because I don't like dealing with mine. But we need to get out of that as well. Of stop telling people to just because I thought about it. You talking about poor Ronald? My wife was having a hard time. The air conditioning was on in the middle of December. The heat was on in the summer. I mean, it was bad. And you're just a lot of older folks was like, just put up with it. You know, that's not right. You're supposed to have it. I'm like, I'm almost 50. I don't plan on having no children. That is the only, to me, the sole purpose of having a period. If you plan on having babies, if you don't plan on having no children, why am I having to go through this pain? Yes, we've gotten folks now that I see that one girl that actually wrote us inside of prison, she's 25 and they're telling her to have a hysterectomy. Now she wanted my opinion and I told her that's based on her, but I would never encourage somebody that young to have a history because you, especially if you hadn't had any children. But again, like Charlotte said, that was the doctor's first thing at you need to have a hysterectomy. And in prison, you can't really rest like you need to rest after a hysterectomy. So that shouldn't even be a question. But yeah, that kind of just bothered me there too. But yeah, I want to just say that. And I
All
think
right,
Tab had a
ladies.
comment.
Tab, you want to say something?
Yes, I need everybody on this call to look up and read the history of Planned Parenthood. And it'll bring you up to date on people think Planned Parenthood is to help the woman, but look at the history on it, what it was designed to do. That's number one. And number two, what I'm just so glad of looking forward to is not being at different conferences and have to, my whole life has been consumed with wearing black pants because you
Mhm.
always black people and women, we always just learn to deal with it. Just deal with it. You
That's
know,
good.
dealing with it is just wearing black pants, suffering the pain or whatever. I'd be so glad when it's over so I can just, it's a freedom to me. And I'm just glad everybody told me how it would be. And because that doctor, what he was saying wasn't meaning nothing. It came from Robin and Walisha. Because what he's saying wasn't meaning nothing to me. This tab is gonna be all right, gonna do that. So we gotta support each other and get some information out there outside of these doctors and stuff. Because the peer-to-peer is more powerful than that medical advice. The medical advice is good, but you gotta, they talking from a book. Here's a black woman. She told me, so you gonna Robin said, Tab, you might have hot flashes, but they got a patch for that. You'll be okay. You need to know somebody that don't went through something to be able to make a sound decision. Thank you.
Good stuff. Well, ladies, we got time for 2 more questions, and I would like to ask that you guys limit your answers to about 2 minutes, and it will be for all of you all. So the first question, because we're winding down, the first question is going to be, what would you recommend to the Georgia DOC or any of the DOCs across the nation regarding the providing of access to quality health care for our incarcerated women? What would you recommend?
I think I'll start off. I think first thing is to apply a gender responsive, patient-centered approach when working with incarcerated women. Understand that women have different needs than men. And I think they also, the Georgia DOC and all the DOCs basically should update their policies and guidelines on the treatment of the women that's in their care. And also expand, I think, for folks to expand and cover the healthcare needs of women, even after their release, if they're on probation, because technically if you're on probation, you're still in the care of the state. So I think applying a gender responsive, patient-centered approach, update policies and guidelines on the treatment that women are receiving in prison and cover the healthcare needs of us once we're released, if we're on paper.
Tab, Charlotte, and then Miss Robin.
I think they need to have, soon as they check into the DOC, they need to do a reproductive report on all women to see where they stand at. And just like they had those hospitals for those men to go to, they had a different surgeons. They need to have a place where the women can go in the DOC where they can get the fibroid treatment there. Not wait till they get out. If they need to have a hysterectomy, they need to have it treated and give them the option. if they gonna take the ovaries out, not just like you running a slaughterhouse and just gonna tell them you're gonna do this, have some self-directed care so they can be involved in their care, get them a voice, which that's been taken away.
And then on top of, because I really like what both Walisha and Tab have said, is to provide that mental health support around that. And specifically talking about that and making sure that the women who may have to get the hysterectomies while they're there, making sure they have the adequate access to truly healing. And when I say healing, healing in a holistic mindset, because as you heard Robin say, you know, when you have the hysterectomy and Walisha, you still have to battle the depression, the mental health, those different challenges. So being able to have the adequate staff to be able to address that, and what that adequate staff may look like, females, because it's probably hard to let a male know, like, you know, I'm battling this because my cycle should start by now, and whatever the case. Men don't get that. They don't grasp that. So making sure there's adequate supports, adequate employees, adequate support to be able to provide the women who are incarcerated with the mental health support that's needed for them to be successful. So when they exit, they're still able to exit with the true definition overall post-treatment or post-healthcare plan that's supportive of their needs. And also too, I would say the DOC needs to understand that one case don't fit everybody's case. One shoe size, one thing don't fit everybody. So to approach it on an individual standpoint and not necessarily one size fits all model, because that's not how we got in prison. That's not how we're doing our time in prison. And that's not how we're going to exit prison.
So my solution would be to get real diagnosis, real medication, and to not always thinking that hysterectomy is the answer. And then for those who do are required to get a hysterectomy, to have real medication when they go through that surgery, to have a real time to heal and not just back on a steel bunk after you've had that kind of surgery. And then to have real support, like Charlotte said, afterwards, of dealing with your symptoms, where somebody's actually listening to, okay, how do we treat those symptoms of you having your hysterectomy, so we can get to a place of true healing.
Real good stuff. Lastly, what is 1 to 2 action calls, if any, that you would like to ask of those on the call tonight regarding supporting and advocating the issue of inadequate and inaccessible health care for those incarcerated women?
I think my call to action would be able to ask the folks on this call to speak up and speak out, to raise awareness about the disproportionate impact of incarceration on women's health, advocate for policy changes that can help improve our overall well-being, and work to extend universal health coverage and access to primary health care for women who are reentering the community. And I think, you know, starting that, being a voice and just acknowledging that. I think a lot of folks be like, oh, no, here we go again. But I think when you open your eyes and say, you know, especially if you are not a Black person, when you open your eyes and say, you know what, it is the truth. I know I get treated differently or whatever, but definitely use your voice to raise awareness about this issue, advocate for policy changes, and work on universal health coverage to cover folks that's also incarcerated.
I'll go. I say share stories. Share your stories about what you've been through. Don't go into the mindset of, okay, I'm done with that now, and leave behind the women that are still enduring it, and sharing your stories and your experiences, because honestly, we talk to commissioners and city councilmen all the time, and they're used to hearing from us. So just remember sharing, and not just this issue, any issue that you endure while you're incarcerated, share that issue, learn about advocating for change for it, because you never know in this society, God forbid, you have to endure that again. And you just want to make sure that you are changing something that people have been doing for centuries and getting away with it because we are being quiet. So we've got to start learning to speak up and speaking out about these issues.
I agree. Share the stories. And we got to be mindful of the people that we vote in offices. Research and see what they share and what they think about reproductive health. And, because that right there says a lot. What do they, we might he might talk good about 2 or 3 issues, but on reproductive health, dealing with people who we put in office, we ain't gonna get everybody for everything we need. But that reproductive health, dealing with us women, that's very, if we lose on one end, it's a win on the other end. Just pay attention what they believe in and what they trying to push across that table and just listen. Sometimes we do better just listening and acknowledging what's going on with a person, and that helps them too.
And then in conjunction with what everybody is saying, pass it on. Don't hold it, because we have a tendency to do that. We get information and we want to gatekeep. No, pass it on, because the information that you just received, even tonight, if you've learned something tonight, pass that on to someone else, because that could be life-changing. Like Walisha and Robin share with Tab their experiences about a hysterectomy, and look at where she's at. This is life-changing for her. So just being able to pass the information on. And then not only that, but if you have a Black daughter, a Black niece, a Black nephew, any youth that's Black, educate them to let them know that they don't have to suffer in silence with whatever it is, fibroids, mental health, whatever. Pass it on and just make sure we're giving our youth the tools that they need to be successful, to the point of where they're not having to suffer in silence. And also too, to make sure you speak up, not just about advocacy and the issues that you hold dear and near to your heart. Also advocate for your own health care. If you don't do anything else, you need to be speaking up about your health care, because that is one of the ways that they silence us. That is one of the ways that they hold us in bondage, and that we're unable to flourish, by making sure from a healthcare standpoint, we're viewed as, oh, she can take the pain. Oh, she's drug seeking. Oh, she's aggressive. She's depressed. She's this, she's that. They're quick to put diagnoses on us, but not to afford us the opportunity for adequate treatment.
That's good. That is so good. Well, thank you, ladies. Right now, we have about 13 minutes. We'll take some Q&A. But before we do, I definitely want to thank the ladies. You did a wonderful job. Y'all do this right here. Show some hearts and stuff like that for those wonderful ladies. I appreciate your bravery and definitely your advocacy. We'll have about 3 or 5 questions, and make sure we try to limit our answers so that we can hear from everyone. If they're non-medical and non-legal, because none of us have said that we're the experts in those areas, and please raise your hand to be recognized. So I will start it off by asking, because you guys have dropped a few of them in the chat. So I will start with asking a few of the questions from the chat that I saw. I think someone said, Robin, what's the name of the patch? My flashes are constant. So, yeah, we don't want them flashes. Like, no.
I put it in the chat. It's called estradiol. And you can get it through your doctor, and to go through your insurance. I pay $5 a month for
Okay, I need to go get me a patch.
30-day supply with your insurance. But if you do not have insurance, it is $74 a month. So hopefully you got insurance, so you can actually not have to go through that. But it's called estradiol. It's the size of a nickel. And you have to put it on a fatty part of your body. Put mine on my butt. So you change it every 3 days, and that's it.
I have to excuse some of us. We'll say anything anyway.
And we
like
keeping
that.
it real, like
keep it
surreal.
real.
This is the
I
end
I
girl.
think we gonna do that. We're
And
gonna
I
do
would tell
that.
you, there was a young lady in the chat also that talked about how she's been going through it. She's had them removed several times. The doctor burned them several times. And sort of like what Charlotte was saying, do what's best for you and your own sanity. I'm 48 and I'm like Tab. Well, actually I'm 49, I'll be 50 in November. I've always worn black pants when I was on my period. Always. And you shouldn't have to do that. You shouldn't have to be held hostage to that kind of stuff and not be able to go to the all white parties and stuff. And it was like, nope, not going to all white party. So when you're on your cycle, so do what takes best for you. If you, especially if you know you're not having any more children, and if that you feel like that is an option, I was so scared to get mine. But let me tell you, it was the best thing. And I didn't want to get it because I got it 30 days before my wedding. And that was the bad timing of it. And of course, I had to wait 6 months. So my wife had she had a hard time. But she was very understanding. I walked down the aisle with my stomach hurting. I was still binded. So, but it was the best thing that I did because I can now enjoy myself. And taking it from a person who has, I think you're supposed to have a normal level of iron, like 11 or 13. My iron was like a 1. And most of y'all, if y'all watch my Facebook pages, I would take my pictures of my 2 Sonic bags and Zaxby bags of ice with their seatbelt strapped on. I would go through 2 bags of Sonic ice, a Zaxby's ice in about 4 days. And so I think I've gone probably, I haven't really eaten any ice this time, but I don't eat it as much. I only eat it when I travel. But I think just here in the house, I haven't had chewed on any ice for like 2 months. And now I've gone and went back to the doctor last month, and he says my level is like a 10. And of course, he has me on iron pills. But before then, it was you need to have the draining or whatever, I forget what they call it. So I'll say that to say it's not just about the cramping and stuff. Your whole life changes. I'm sure Robin's husband's not dealing with all the different fluctuating stuff. My wife's not hearing me chomping. Robin will tell you, I'll go in public in a minute to an event with my cup of ice. In the back seat of my car is ice cups from Quick Trip, Racetrack, Zaxby's, all the way in Savannah. What is that place down in Savannah with the good chewable ice? Fossils or whatever. I have a cup for every place to stop and get ice. Parker's. So I got cups in my car for everywhere I go to get ice. So no longer, y'all are laughing, but seriously, I was like a hostage to ice. And that was probably because of the fact that I needed and I was bleeding so bad and so much. So don't let that change you. Like you said, like Robin and everybody done said, do what's best for you. And I was scared too, especially when you got your care on somebody else. But hopefully, of course, we're going to be there rallying around Tab when she has hers. But I'm going to tell you something, you're going to be in so much, just the freedom of it. And just take care of yourself. Do what's best for you.
So do we have any hands up? Because I can't see any. Shaniqua?
I don't see any.
Not seeing any. And I don't see any hands raised.
Any of you nice, quiet ladies that have been so kind and listened so intently. This was an awesome conversation, first of all. Do any of you all want to unmute yourself and ask a question or maybe share 30 seconds of what you took away from it?
Good evening, everyone. My name is Lisa. I just want to say to the ladies on the panel, thank you so much for your transparency. And I gained so much insight. I knew that there were issues, but not to the depth of what you all spoke about. So I just really want to thank you all for sharing and bringing in awareness and enlightening me on something that I really didn't know a whole lot about. So thank you for that.
Hi, can you hear me, Dina?
Oh, yeah, go ahead.
Hey, Walisha and everyone.
Hey, Florence.
Hi. Truly, I thank you, ladies, also. Matter of fact, me and my daughter was holding this conversation last night, and she was saying, "How come you older women didn't tell us about these hot flashes?" she was she was kind of a little, upset because of what she's going through, and she said we had not talked about it. And so I would say, yes, we need to share with the younger women what our bodies go through so they can be kind of prepared um, for menopause. And my daughter, she just had surgery a few weeks ago, and I think they took one of her ovaries. I had something like that probably about 25 years ago, just taking the uterus. So I had both of my ovaries. So I had not really had hot flashes, but I've been going through it lately and around the neck and the head and just all kind of weary and everything. So that's how we got to talking about it. And she was saying, well, I thought, Mom, that you'd have been went through it. You know, you 63. I said, well, baby, it just now hit me and it ain't no joke. So I don't like this, you know. And I did see my mom when she went through it and how it even messed with her mentally, you know, just talk crazy and do crazy things. So yes, we need to make our young women aware of the changes that their bodies go through when they're going through menopause and what might happen. And I do, like Walisha said, I do think it's like one of the best thing that ever happened when I did have the surgery for say, because the bleeding was terrible, straight through the pants, you know, scared to go anywhere because of the fibroids, you know, and the pain. I mean, there was times in my life I said I'd rather be dead than have to deal with a pain like this. So the pain be terrible. So yes, thank you ladies for sharing, and I have truly been blessed by this segment and would like to continue to come and hear what other women have to say about different subjects. You all have a great night.
Thank you.
Would definitely keep you informed when this powerhouse, I think they call themselves the Fabulous Four or something to that regard. I don't know. We just gonna
It's the core four, and we drop off the hardcore, and we just put
core
core four
four.
on now.
Okay, the core four. Demetrius, I see your hand up.
Yes, I just wanted to thank the ladies on the panel. And I too dealt with fibroids and endometrial before I was incarcerated, and also had a hysterectomy before I was incarcerated. And thank God I did, because I wouldn't have survived and never hit it. But I did see other ladies going through it, and I would go get my pads to get to them so they would have enough. So I did witness that. But this was an awesome conversation. And again, thank you, ladies.
Wow, the humanity on the inside, right? The humanity from the inside. I see your hand up and it says Melanie Jones. So, and I have about 8 of you all in front of me right now. So if you want to unmute and
It's
start, there
Carolyn
you go.
Forehand. My
Hey,
name
Miss
is.
Ford,
Hi,
don't
how
say
you
that.
doing?
Miss
I
Thomas, you can come in.
I
Go
was
ahead.
so excited to be here, because when I really realized what y'all was talking about, it's something that I've been dealing with for years. And it's been such a stress on me, because, you know, when the doctors try to tell you you need to get a hysterectomy and you don't want to get one, and they try to force you to get one. And I used to take this stuff called Pardiaco, it stopped a whole lot of bleeding, because I used to have to wear tampons, I had to wear pads, and I had to wear tissue. And I was in school at Atlanta Area Tech, and I had to fight and I had to change. And I just really couldn't go nowhere, because I would mess up my clothes. But the doctor who did this to me after I had my last son, he said, every time I turn around, you having a baby. Not knowing that when he convinced me to get my tubes tied, he burnt my tubes. And that's where the fibroids came from. But I used to have such a pain that was so unbearable. It was worse than labor pain. And I was be like, what in the world? How can somebody hurt like this, like somebody consistently stabbing you? And I couldn't go nowhere, because I would bleed so heavy. I would bleed 2 weeks and then stop. And then 2 weeks later, I was bleeding. But once I started moving in Clayton County and started taking this tea called Pardiaco slowed the bleeding down. And I have not had a psych in 2 years. But I have 3 fibroids that I need to deal with. And that's something I have prayed about. Help me find something that I can put together to at least cure myself, so I can give it to somebody else to use. But Pardiaco is one of the things. It's a tea, and it's a herbal tea, and it stopped my bleeding. They have it in pill form and they have it in powder form. And it literally stopped my bleeding. I haven't had a cycle in 2 years, literally.
Are you planning on having more children?
No, I'm about to bust 59 next year. I'll be
Okay,
60.
so why are you not thinking about actually having a hysterectomy?
Because I want to
You look good to
wanna
be, I'm gonna tell you, you look good to be 59 now.
listen. I be so determined to do stuff. And even if I do eventually have a hysterectomy, I want to defeat the purpose of saying I wanted to defeat the purpose and saying that I can't win with this. When I get my mindset that I want to do something, I'm going to do it. And I really believe that I can find some kind of tea because, like I said, that Pardiaco, when I had, cause my stomach used to be big and I had cysts. When I started taking that Pardiaco, it started shrinking.
Okay.
But I wasn't consistent. I did it for a long time and then I stopped. But I just started back taking it and it's been consistent. And when I started back taking it, maybe about 8 months ago, I have not. I cramped real bad, but I didn't have a psych in 2 years. But I have not had no cramps at all. And I really believe in my spirit that I can find something that work.
All right.
So,
Well, if
Ms.
you find it,
Thomas,
let
I
us
think
know.
I definitely will.
definitely let us know.
But don't
Ms.
forget
Thomas,
it's called Pardiaco. It's a tea, it's called Pardiaco.
Okay.
Pardiaco.
Yeah, it's expensive, but it's worth it.
Type it in the chat.
I definitely will. Okay.
Okay.
Ms. Thomas, if you want to be the last person before I turn it over to, I think Shaniqua was gonna close us, and so out of respect for everybody's time. Okay, we see your mouth moving like the Chinese man at the 25-cent theater, and you stuck in the air like this, and that's all you doing there.
You unmute, you muted.
Let's see if we can ask you to unmute.
I was in prison 2016, and at that time it was the GAMS that was over healthcare, and I had I had been there. I did 15 years. 2016 would have put me somewhere around 11 years at the time, where I was going to healthcare consistently. You know, doing my Pap smears. I'm doing everything, and y'all, ignorance is bliss when it comes to me and being taught, you know, how to see my body, how to take care of my body. I never, you know, like I never wore tampons. I wasn't taught those things by my mom. Well, 2016, I go in for my annual pep, and it's Dr. Gams. And Dr. Gams, y'all, he violated me so bad. He just took his hand and just rammed it in me. And and when he pulled his hand back out, it was bloody. All right. So at that time I began to fight him. I'm not doing it. No, either you can get me a lady, get Nurse Livingston in here to do this pep, or I'm just not gonna do one. Because he didn't, as strange as it was, he didn't understand why his hand came back out bloody. Like, I only jammed the one time, what that he was saying. Well, the nurses, healthcare, nobody would allow Nurse Livingston to come in there and do my pep. Well, I fought it and I fought it, and around I think about 2018, finally they decided to let a female do my pap. I'm a rape victim, y'all. Keep in mind I'm a rape victim, and they refused me a female. Well, that Nurse Livingston comes in and she does her little feel, do the little thing they do. Well, she couldn't get no more than the tip of her pinky in my vagina. He couldn't get no more than the tip of her pinky in my vagina, because the fibroid cyst had grown so big that it was literally pulling on my uterus, trying to come out of my vagina from the size it was. Well, they're calling me because I'm still, like they still telling me but you gotta let Dr. Gams check you before you can go and have surgery. And I was adamant. Listen, woman, I'm gonna go to mental health, check my records. I am a rape victim. I don't do men checking me. And after he rammed his hand in me, I'm surely not gonna let him go back in me. But y'all, they were trying to force me, because I said no to Dr. Gams. I felt like they was trying to force me to let him back inside me in order to help me. Well, needless to say, I didn't let Dr. Gams do it. They had to call my family in order to get me to allow them to even do the surgery. Because I'm telling y'all, I don't want to be cut. I've only had one child, she was by rape. I want a baby, bro. I really want to try having this, and you're telling me that you can do a half hysterectomy, and I would still be able to, to have carry a child or something. Some ignorant. They was telling me that if we do this half, you'll still be able to have children, and it didn't sit well with me. I'm just like, y'all. I'm telling you, when they put me to sleep, them people cut me. And I signed paperwork saying I did not want to be cut, and those people cut me anyway. I was numb. Okay, after they opened me up for the remove the fibroid cysts, y'all had 22 of them, not just that one big one. I had 22 fibroid cysts. I had endometriosis that they had missed. I didn't even see it until they opened me up. I stayed paralyzed, like my lower bottom, like my vagina, my thighs. I had no feeling in them. I stayed numb for 6 months, and they told me, "Hey, that's normal for you to just not have feeling." When these hot flashes, I have hot flashes from sunup to sundown every single day. And the first thing I've ever heard of getting any kind of help was when y'all just said it on our Zoom meeting. So y'all, I am grateful for this meeting. I'm grateful for Ms. Flo for even inviting me. I thank y'all because I have been tortured with what I feel like is negligence with the ADOC.
Well,
we pray
thank you
that.
so much.
Yeah, we definitely sorry that you've gone through all of that. And I think in this space, and I'm grateful for the safe spaces that we're consistently creating amongst those that have been impacted. And I definitely want to I see some of the guys are on here. So thank you guys for always showing up and supporting us women in so many different ways. And Elizabeth, if there's anything else that you may need, you have my number, and what I will do is I will send it out to the panelists or whomever and then see if there's a way that they can aid and assist you in a way that I don't know how or understand. Really appreciate you guys again for just being so wonderful, to bring this topic, to bring this discussion. Definitely is something that we needed. And we need to continue to speak out about those things that does impact us, and without fear, without shame, without guilt. I think that too, and know that it's our right, and it's definitely our duty to be able to bring forth the things that impact us the most. And so with that, I say thank you for giving me the opportunity and the honor to lead such an amazing conversation with some amazing people, the core four. And I'll turn it over to Miss Shaniqua.
Thank you all. That was a very much needed conversation. And I again learned, I always do. I always learn a lot from these women. I always learn, from our participants and people in the program and anyone who ever comes to these events. Like, we all share, experiences just as women. And I think this was so important. But Dina, I want to thank you for doing an amazing job today. The panelists, thank you, and all you attendees. And I want to inform everyone that all chat drops will be emailed along with the recording, and invite everyone out to our upcoming events. This was a great event here, so imagine what can come next. So thank you again, ladies. I'm going to turn it over and send you some information about how you can get in contact with us, how to register for the HOAPE Coalition, how to connect with, all of us in this space. So thank you again. And I hope that we all have learned from each other.
And I think I have a request from a couple people to get this recording, if it's made possible for some that can't.
It'll go out Friday. All the chats, everything in the chat, all the even Dina's bio that Shaniqua didn't get to read will actually go out in the email. All the chats, including this video for folks who weren't able to join, will actually go out in email Friday. And so all of you will receive that email.
Ladies, thank you so much again, and for everyone that came on to support as well as learn something. One of the guys just texted They keep bringing awareness. I've learned a lot. So ladies, outstanding. Y'all have a wonderful, wonderful Wednesday.
You too.
Bye, ladies.
Thank you.